Good morning, everybody. Thank you, Dr. Okuno, for the introduction. As mentioned, my name is Rich Riedel from the Duke Cancer Institute. It's my pleasure to provide an update on SARC032. Before I start, I'm going to apologize in advance. My ears are still clogged from last night's flight, and I can't tell if I'm yelling or not. It sounds like I'm whispering in my head. Also, just want to congratulate SARC on the 20th anniversary. I'm not sure if I didn't read the banner that I would have actually known that. So congratulations to SARC on 20 years of advancement in the field. So I'm happy to present on behalf of Dr. David Kirsch, the overall study PI, as well as co-PIs. I serve as the co-PI for medical oncology, Dr. Yvonne Mary for radiation oncology, and Dr. Brian Brigman for orthopedic oncology. And again, SARC032, a phase 2 study, randomized controlled study of Pembrolizumab with radiotherapy and adjuvant Pembrolizumab in patients with high-risk localized soft tissue sarcoma of the extremity. This is a study for which SARC serves both as the sponsor and the coordinating center. Funding is provided in part from Merck and Stand Up to Cancer. Merck also provides a drug for which we are very appreciative. This is an IND-exempt study. The background and foundation for 032 is based on Dr. Taube's study, now about 6 years old, SARC028, which showed efficacy for the use of checkpoint inhibition, specifically Pembrolizumab, in select histologic subtypes of sarcoma, namely undifferentiated pleomorphic sarcoma and liposarcoma. And as we heard this morning, and other studies, there's growing preclinical data supporting potential synergy between radiation therapy and immunotherapy, as shown here. With that in mind, 032 is a randomized phase 2 study consisting of a control arm of preoperative radiation therapy followed by surgical resection, with an experimental arm incorporating the use of Pembrolizumab, both concurrently with radiation therapy and that as part of adjuvant treatment after resection. Select inclusion criteria are shown. This is for individuals at least 12 years of age or older. They have to have intermediate or high-grade soft tissue sarcoma, specifically UPS or liposarcoma. Needs to be at least greater than 5 centimeters in size and limited to the extremity and or limb girdle. The study aims to accrue 126 evaluable patients in total. Patients are randomized in a 1-to-1 fashion. The study scheme is shown here. Patients are stratified by grade and then again randomized to either the standard of care arm or the experimental arm, which incorporates Pembrolizumab, as shown on the bottom, prior to radiation therapy, concurrent with radiation therapy, and then post-radiation therapy. There's then a cooling off period followed by surgical resection and then adjuvant Pembrolizumab for the experimental arm to complete up to a year of therapy. And again, this is compared to standard of care therapy, which is preoperative radiation therapy and surgery alone. I think a strength of this study are the embedded correlatives. We heard from Dr. Tapp this morning about the importance of really integrating biomarkers and correlatives in our studies. This study is robust with them, both in terms of blood collections prior to treatment, on treatment, post-treatment, as well as tissue collected as biopsy and then upon resection. Just want to acknowledge the sites. There's 13 U.S. sites, 11 of which are still open. I'll highlight the investigators shown here, as well as a number of international sites here with Australia, Canada, and Italy being represented. So certainly appreciative of all the investigators. This is where we are. We're at 119 evaluable patients. We need to get to 126. So for the folks who have the study open, please consider putting at least one patient on. If half the sites do that, we're done. So we're really, really close. And again, appreciate the efforts of the investigators to date. This is the timeline. If we accrue in a timely fashion, we hope to be done by the end of this year or early 24. So really an important study, and we're really, really close. So appreciate folks' efforts. Just to revisit the correlatives here, at the bottom here, we're collecting PBMC, ctDNA, whole exome sequencing, RNA-seq, and looking at the immune classes that we heard a little bit about this morning. We're looking at ecotypes, trying to correlate that with response. So in summary, really, really close here, 7 patients to go. And the hope here is that the correlatives will help inform future studies. So with that, just a final slide, thanking all of our sponsors. Thank you for your attention. Thank you.